Women are cyclical beings living in a linear world. So, why the heck is it so hard for us to find our rhythm when it comes to diet and the bathroom? Our bodies send signals every single day, from energy crashes to bloating to how often we are running to the bathroom. But instead of learning to listen, most of us have just been taught to push that to the side, normalize our discomfort, or just chase the next diet trend. Don't even get me started about us not talking about what's normal when it comes to the bathroom. In this episode, we are slowing down to look at the ins and outs of nutrition and bowel and bladder health. I wholeheartedly believe that your diet and your bowel and bladder function are key ingredients to the recipe to your health and wellness. Learning about these things will help you to understand what is normal and how your body should be functioning. So let's talk ins, hydration and diet, and let's talk outs, urination and bowel movements. I'll give you the doctor basics, and then I'll give you the sister strategies, because sometimes you need a doctor to tell you these things, and sometimes you just need your sister to connect with you about these things. And of course, we will talk about the actionable things that you can do starting today to implement this knowledge into your life. Let's get into it, besties. This is your sister, the doctor. I'm Dr. Abby Rose. I'm a pelvic health PT, and let's get into it. Welcome to our Back to the Show. All right, guys. Welcome to episode 4 of the season of the recipe to your health and wellness. And today we are going to be talking about the letter I, which stands for ins and outs. Because ins and outs really do impact your health. And as a pelvic floor PT, I'm a little bit biased, but I am so passionate about this. So it's something that every man and every woman really need to know, but especially women, because we don't talk about these things. So let's get into it. So first we're going to get into the doctor advice, and then we will go on to some sister advice. So to start us out, we're going to talk about something that is crucial to your bladder, to your bowels, to your energy levels, and that is hydration. Hydrate or dihydrate, baby. So hydration is something that every single person needs to think about. With every single pelvic floor patient I work with, I ask them how much water are they drinking. And the answers always surprise me. And the general recommendation for the average person to drink water is half of your body weight in ounces of water. And I would bet that not even half the population is getting that. And, if you're like me, it's so easy to forget about this. But I'm going to tell you why you need to hydrate. Hydrate or dihydrate, baby. So half of your body weight in ounces of water is what is recommended. So if you weigh, let's say, 160 pounds, you should be drinking 80 ounces of water per day. And that's a lot of water, especially for my people who come in and tell me maybe they drink 4 glasses of water a day. So if you are one of those people who are not meeting their fluid intake goals for the day, I always tell my patients, start gradually. So if you are currently sitting at 4 cups of water and you need to get up to 8 cups of water, every day or so, add on another cup of water. And it's going to feel like you're going to the bathroom more often at first, but your bladder, it's going to normalize. So as you start drinking the recommended amount of water, you're actually going to go at more of a normal frequency. And we'll get a bit into that, but something that really surprises every single person I talk to is that staying hydrated actually helps with your bladder frequency. So if you are somebody who struggles with increased urination, not being hydrated can actually irritate your bladder. So we want to be drinking more fluid so that you're going at a normal frequency. And we'll touch on that in a little bit, but just wanted to point that out. If you are pregnant, you should be drinking more water. 101 ounces is recommended for pregnant ladies. And if you are breastfeeding, you should be drinking even more water. 128 ounces is recommended for breastfeeding ladies. Even mild dehydration can cause fatigue and reduced endurance. Cells need water for ATP production. If you're dehydrated, your cells are not going to be able to produce energy, which is why you feel sluggish if you are dehydrated. Dehydration can make exercise feel much harder than it has to be. It can reduce the motivation to move because your body doesn't want to create that energy because you don't have that fluid. Dehydration can impair your attention, your memory, and your cognition. Brain cells rely on hydration for neurotransmitter function. So low water intake is going to alter your brain function. Water is so essential for nutrient absorption and for digestion. And if you are dehydrated, you are going to be bloating or constipated. If you are dehydrated, your bladder will be irritated and you will be going to the bathroom more frequently. If you are dehydrated, the fiber that you are eating to help normalize your bowels isn't going to work because your fiber will not be able to dissolve if you are dehydrated. So poor hydration will lead to bloating and feeling sluggish and low energy, and it is this vicious cycle. We are 70% water? So, gotta stay hydrated, baby. Okay? Thank you for coming to my TED Talk. Please hydrate. And I need to practice what I preach. I'm not gonna lie, guys. I am not the best person about hydration. However, we'll talk about that in sister advice. Okay? So, now let's talk nutrition. So, we're gonna talk about some skills to improve your nutrition. And that's learning to honor your physiological cues. There's something called the hunger and fullness continuum. And so 0 or 1 means you are ravenous. You are so hungry. And then 10 is like you are overfed, you are stuffed, it is Thanksgiving, and you cannot eat anymore. It is recommended that you start to eat when you're about a 3 to 4 on the scale, and that you finish eating when you're a 6 to 7 on the scale so that you are comfortable. You are not overeating and you are not undereating. So it's just a tool to kind of help you with this. There's a difference between physiological hunger and a psychological want. Sometimes you may have cues from your body that you are hungry, and maybe it's just a psychological thing. Something that can help with this is eating slowly and eating more mindfully. So eating undistracted without the TV on, taking smaller bites, chewing your food fully, taking deep breaths before meals. This can all help with your digestion. Because remember, digestion is rest or digest. It's your parasympathetic nervous system. So when we're multitasking and we're eating, your body is still in fight or flight or sympathetic if you are like, say, driving or watching TV or doing something. So we want to be eating and slowly chewing our food and calming down the GI tract to help with your digestion as you eat. Ensuring that your food is nutrient dense and good quality. So limiting your processed foods the best that you can, trying to eat whole foods, nutrient-dense foods, eating a colorful plate of vegetables, things like that. And then as far as portion sizing, a good rule of thumb is your thumb is actually the serving of the fats that you should be eating. Your palm is protein, fist is vegetables, fats is thumb. So just thinking about when you're planning out your meals, portion size, because sometimes you might be overeating or undereating. And I just want to say, with all of this, I recommend seeing a dietitian or a nutritionist because they will help guide you as to what you should be eating and shouldn't be eating. Just in general, I think everyone should meet with a nutritionist at least once in their life. I have a nutritionist and I find it very helpful. So, okay, let's talk about diet as in fiber, proteins, macros, gut health, things like that, all these hot topics. And I am no expert on this, but I just want to touch on these things because they're all very important. So these are just kind of general recommendations. So fiber is your friend. Fiber is very important. And you want to get a diverse variety of fibers in your diet. There are two types of fibers. There's soluble fiber and insoluble fiber. And you want to have both of these things. So soluble fiber dissolves in water to form a gel-like substance that helps with the gut and digestion. So these are things like oats, lentils, apples, citrus fruits. The benefits for soluble fiber is that it helps lower your cholesterol and support heart health, slows digestion, helping with blood sugar control, and it feeds good gut bacteria, which we'll talk a little bit about gut bacteria in a minute. Insoluble fiber doesn't dissolve in water, and it adds bulk to your stool. So sources would be like whole wheat, nuts, seeds, vegetables, green beans, cauliflower, things like that. benefits is that it promotes a regular bowel movement and prevents constipation. It helps maintain healthy gut motility, and it helps detox waste more efficiently. So both of these types of fiber are essential. Your body needs soluble fiber for heart health, blood sugar control, and gut microbiome health. An insoluble fiber is important for being regular with bowel movements and digestive comfort. Typical recommendation for women is 25 grams of fiber per day. And recent research has shown that there's really no upper limit to fiber. So the more fiber that you can get, honestly, the better. And then as for men, it's a little bit higher. So typically 38 grams of fiber. The thing is, you want to gradually increase your fiber intake because you could potentially have increased bloating or gas if you are to increase your fiber all of a sudden. So fiber can be classified as a carbohydrate most of the time, but we'll talk about macronutrients a little bit. So we have protein, carbohydrates, and fats. Okay, so protein, there's a lot of talk about protein because it is so important for your gut health, and just as women, we need more protein. So protein is really great for hormone health. It is essential for blood sugar balance, for insulin levels. It is recommended that you are having 20 to 30 grams of protein per meal, or 60 to 100 grams of protein per day as women. And this is just a general recommendation. Men, it's a little bit higher. The general recommendation is 1.2 to 1.6 grams of protein per body weight kilogram. Animal protein has a more complete amino acid profile, and plant protein does not. So sometimes you need a little bit more plant protein to get that full amino acid profile. Protein is so important because it builds and repairs tissue, and it helps with neurotransmitter activity. It also helps increase your microbiome, which is always a great thing. It is crucial for creating more muscle mass, especially for women. It is helpful for pregnancy. It is helpful for your metabolism. It is helpful during perimenopause. So protein is essential. Carbohydrates are fuel for gut bacteria. So there's complex carbohydrates, fruits, vegetables, beans, whole grains, which produce short-chain fatty acids. And these things help reduce inflammation and promote gut lining. Refined carbohydrates feed less beneficial bacteria, trigger bloating, and increase mood swings. So for women, it's very important to eat fiber-rich carbs to help stabilize blood sugar and reduce symptoms of PMS and things like that. And then fats are needed for hormones and absorbing nutrients. Some healthy fats include avocado, salmon, olive oil, things like that. And these things are anti-inflammatory. Omega-3s help improve your gut lining. Too much processed or saturated fat can lead to inflammation and less gut diversity. So with macronutrients, you want a balanced plate. And typically, the general recommendation is half of your plate should be protein. A fourth of your plate should be vegetables. So you want to think about there's a couple different recommendations for how the plate should be shaped. And I'm sure that you guys have seen my healthy plate and things like that. You could use the fist roll and the palm roll and things like that. My nutritionist recommended, just to keep things simple, having about a fist size equal of, but she did it protein, vegetables, and carbs. So, and then you want to have fats there as well. So, like I said, working with a nutritionist is very helpful. So a little bit on the digestive system. The digestive system is a second brain. That's what they call it, because your gut produces hormones. And fun fact, 90% of your serotonin is created in the gut. So taking care of our gut is very important. And I'm sure that you guys have heard all about gut health. So let's talk a little bit about it. So what is the gut microbiome? The microbiome is made up of trillions of bacteria, viruses, fungi, and other microorganisms or microbes that live in your digestive tract, which is actually crazy to think about. These microbes help you to digest your food, make vitamins, regulate your immune system, and communicate with your brain through the gut-brain axis. The reason why this matters so much for women is because of hormone balances. Estrogen and progesterone can influence gut bacteria, and gut bacteria can influence hormone metabolism. Digestive health is important because a balanced microbiome helps prevent bloating, constipation, and things like that. It also helps your immune support. So a healthy gut can protect you from infections and inflammation. And gut bacteria produces neurotransmitters that help with your mood and your energy levels, which is really cool. Key factors that affect women's microbiome include their diet. So getting plenty of fiber-rich foods and plant foods with helpful bacteria that help to feed bacteria in the gut. Stress, because chronic stress can reduce microbiome diversity. Sleep and circadian rhythm, which we talked about in episode 1, because poor sleep can alter gut composition. Antibiotics and medications can impact this because they can disrupt the microbiome environment. And hormonal fluctuations, the menstrual cycle, pregnancy, menopause can all affect the microbiome. So in order to support a healthy gut microbiome, we want to eat diverse, fiber-rich foods, including fruits, vegetables, legumes, and whole grains. We want to include fermented food, including yogurt, kimchi, kombucha, and we want to limit highly processed foods and added sugar because these can feed less beneficial bacteria. And then, of course, staying hydrated supports digestion and microbiome activity. And managing sleep and stress, some things you could do include meditation to help downregulate the nervous system, movement, like we talked about in episode 2, and rest, like we talked about in episode 1. So you can see how all of these things, episode 1, 2, and 3, all kind of go into episode 4, which is really cool. And nutrition, like I said, is something we could spend a whole season on. However, I just wanted to share some of the basics with you guys so that you know what you're putting into your body, because this affects what comes out of your body. So that brings us into bladder health and bowel health. So let's talk about bladder health first. So as a pelvic floor PT, I am always telling people what bladder norms are. So just so you know, bladder 101, normal voiding intervals for your bladder is every 2 to 4 hours. If you're going more frequently than 2 hours, that might be too much. Normally, your bladder can hold about 2 cups of urine before it needs to fully empty. So when you're going to the bathroom, your stream should be 10 to 20 seconds long. If it's less than that, maybe you didn't actually have to go. You want to avoid going just in case, like before you're leaving the house, because that will train your bladder to go when it actually doesn't need to go. Your bladder and your brain are connected by the nervous system. So when your brain gets really excited, your bladder also gets excited. If you're like, where's the next bathroom? Am I going to make it in time? That's going to cause the bladder to get excited. And it's this loop. When people have urge incontinence where they're rushing to the bathroom because they're afraid that they might wet themselves, then we have to stop, take a deep breath, and kind of calm down the nervous system, because it is a nervous system response. It is only normal to go to the bathroom at night if you're over the age of 65. So I recommend that you stop drinking fluids about 2 hours before you go to sleep, or an hour and a half before you go to bed. When you urinate, you should not have to strain. You should not have to push. It should just flow out. Because if you relax your pelvic floor muscles, your bladder will naturally contract and let the urine out. So no straining, no pushing, no going just in case. Try to limit fluids right before bedtime. Normal voiding interval every 2 to 4 hours. One time if you're over the age of 65 if you go at night. And then certain foods also irritate your bladder. So think of the 4 C's. You've got your citrus foods, carbonation, your alcohol, and caffeine, of course. So all of these things can increase the frequency that you're going to the bathroom because it irritates your bladder. That does not mean you need to cut all these things out of your diet, but just drink more water when you have these things. I've met patients who had very frequent intervals of using the bathroom, and it was because they were drinking so much caffeine during the day, or lemon water, things like that, because that can irritate your bladder. Okay, guys, this is my favorite part of the episode. This is when Finally, drum roll please. I'm just kidding. All right, guys, my absolute favorite thing in the world to talk about. Let's talk hot girl shit. Yes, bowel health. This is near and dear to my heart because me and my family have struggled with our bowels my entire life. And so I am passionate about poop because we've been through a lot, okay? So becoming a pelvic floor PT and learning these things, I have so much appreciation. And I really wish that I knew some of these things when I was growing up. And my job is to spread awareness now because I've learned a lot. So your girl has always had IBS and self-diagnosed. I'm getting ahead of myself, but I want to share. And this is a little bit of a sister tangent, but I have always had IBS and I didn't really know why. When I was a little girl, before I'd get on the bus in the morning, I would have the shits and I would run to the bathroom and be in the bathroom because I was nervous I was going to miss the bus. And every time I was driving to work as an early adult, or if I was about to give a presentation, or I don't know, randomly I would get nervous and then I'd have to run to the bathroom. And I always was on the more diarrhea side. And my family was like that too, so I just thought this was normal. Come to find out that things like taking probiotics really helps, making sure I'm getting enough fiber and water in my diet really helps, and regulating my nervous system really helps because like I talked about with the urgency suppression, how your brain and your bladder are connected, and sometimes when your brain gets really excited, your bladder gets really excited, and it's this loop. I've kind of found that similarly, when I get really nervous and my brain gets excited, and then I have the urge to go to the bathroom on top of that, number two, I really have to go. If I'm able to calm down my nervous system and I can regulate and take deep breaths and things like that, the urge will pass so that I can make it to the bathroom in time and not poop my pants. Anyway, that was a little tangent. TMI, said no pelvic floor PT ever. But just so you guys know, as far as bowel movements go, normal frequency is every 3 days to 3 times a day, which is a huge range, but most people fall in the range of once a day. And there's something called the Bristol stool chart. So type 1 is more constipated, and type 7 is more diarrhea. And type 4 is the normal one. So I will put a picture here, but typically type 3 or 4 is normal. I, for most of my life, was sitting at 6 and 7, but now I'm getting more onto the type 4 with some lifestyle changes, which is really great. Honestly, bowel health is very complex, and patients that I treat that have bowel symptoms, it's often more than a pelvic floor issue. It's a gut microbiome, a nutrition, or some sort of underlying health condition issue. However, for basic bowel health, the things that you want to think about are fiber and fluid. So staying hydrated and eating a variety of fibers throughout your day are really going to help. Normal consistency is at type 3, and normal frequency is every 3 days to 3 times a day. As with urination, you don't want to strain to have a bowel movement. There's certain breathing techniques that I teach as a pelvic floor PT that really help to have a bowel movement appropriately. So you want to think about breathing big and hard into your belly, creating some abdominal pressure, and letting the pelvic floor open up. I always think of the cue of blooming flower. So you're opening up your pelvic floor and letting it relax. So you're using your breath to relax and bear down into the pelvic floor versus straining. Having a bowel movement, you should not have to strain. It is easier to have a bowel movement if your feet are propped up onto a stool, if you've ever heard of the squatty potty. That increases your anorectal angle. So basically, there's a ligament that blocks off the colon when you're just sitting on the toilet. But if you squat, it opens up that angle and lets the feces come out better. Recommend squatty potty for everyone as well. Okay? So that was my doctor advice. on hot girl shit. Okay. Okay, guys. So we are finished with the doctor advice, and let's get into some sisterly advice. Okay. So, number one, let's talk about hydration. And I think something about hydration that I really want to share, sister to sister, is that my nutritionist kind of teasingly suggested that I take shots of water. And like a shot glass of water throughout the day, because I really, really struggle to get my recommended ounces of water in per day, especially as I'm seeing patients throughout the day. And I'm sure just working a busy schedule, sometimes you don't always like if you're a teacher or if you work with kids or if you work with patients, like it's really hard to get all the water in throughout the day consistently, right? So something that my nutritionist suggested is that between patients, I drink about 4 ounces of water, or 2 to 4 ounces of water. So kind of like throwing back a shot of water consistently throughout the day. You want to sip on water versus chugging a bunch of water at once, because that'll just make you to go to the bathroom more. So sister advice number one, take shots of water, which it's kind of fun, right? You can also get like apps that tell you to drink water, like the Water Llama app. Finch is another one that I use. I've talked about it before. You can get one of those water bottles that have like the time of day on them. You can set alarms, which I've been meaning to set alarms on my computer. So while I'm at work, I can just like say, oh, I need to do my water. But yeah, so setting alarms, using phone tracking, using paper tracking, using a water bottle to track it, that sort of thing. You can always infuse your water with some flavor if you don't like the taste of water. So just be mindful with like the citrusy things that might irritate your bladder, like I said. But like doing it a little bit is fine. I really like cucumber in my water, lime in my water, things like that. Starting your day with a glass of water, because when we sleep overnight, we do get dehydrated. So if you're able to drink some water first thing in the morning, that's great. And using cues like your urine color. So your urine should be pretty clear, and your thirst. So if I had someone tell me, if you're thirsty, that means you're dehydrated. And I don't know how true that is, but potentially yes. So think about the cues that your body is giving you. If you feel thirsty or if your urine looks bright yellow, then maybe you need to drink a little bit more. And then including vegetables, fruits, things like that that have water. So watermelon, celery, things like that. And then for workouts, the heat, things like that, adding some electrolytes to your water. I really love coconut water for that. You can just add like a little bit of salt too to your water, because that'll give you some electrolytes. Or if you like those little packets that have flavors, those are fine. Like the Element or I forget the other brands, but sometimes you have to be careful with those though, because sometimes those kind of things can irritate your bladder. So just make sure that like the ingredients look natural and not so artificial. So water's hard, guys, but I'm going to challenge us all to start drinking half of our body weight in ounces of water. And if you increase your fluid intake, expect that the next 2 weeks you're going to the bathroom more frequently, because your body's not used to that if you've been drinking like half of the recommendation. But over the 2 weeks, it should normalize and you should be going more frequent. You should be going every 2 to 4 hours. So let's talk about some diet tips, meal planning, things like that. So I personally like to kind of plan my meals out at the beginning of the week and fit grocery shopping in whenever I can, making a list and making a meal plan. So you want to make sure that you are getting enough vegetables, like fresh produce. So I have to go to the grocery store every week to get my produce fresh. And then if you want to make things easier for you, just find like a couple carb sources, a couple veggie sources, a couple protein sources, and kind of rotate through those and mix and match and combine things. You want to set yourself up for success. So if you know that there's a night where you're going to be home late, make some easier options that you can just like say throw into the air fryer or something. Like I have this like breaded chicken that I get from Costco that I just love to throw into the air fryer. And then like the days that you have more time, spend those days with like prepping your food, cutting up fruit, cutting up vegetables. I really love having a veggie chopper. I think that has changed my life, because now I like to make like bean dips and things like that. So I don't feel like I'm cutting up peppers all day. Peppers, tomatoes, cucumbers, whatever. You just put them on the veggie chopper and you just chop it. It's so nice. So doing things like that, freezing your foods. Like if you buy a lot of chicken or you buy even like bread, I find that bread goes bad really fast. So if you put it in the freezer and then just like thaw it when you need it, I think that helps a lot. Especially if you're like only a 1 or 2 person household, because we don't go through bread that fast. And then I recommend that everyone at least have a consultation with a nutritionist, because they can kind of give you some personalized recommendations based on your preferences. If you have any allergies or intolerances, someone who specializes and is educated in this realm is better than following some random advice on Instagram. That being said, there are some really great sources out there. I really love the Sculpt You's nutritionist. Her name is Melody, or Salt of the Earth Nutrition. I'll put her information in there. I love her for some hormone health related nutrition advice. I'm trying to think of anybody else that I follow, but there are some good influencers out there that know what they're talking about. Just make sure you look at their credentials. There's a difference between dietitians and nutritionists. There's certain nutritionist certifications that you can get that don't require a lot of education. So just be careful. But anyway, all that being said, I'm not a nutritionist, so take everything I say with a grain of salt and know that I'm just giving some general recommendations and guidelines. If you struggled with an eating disorder in the past, I highly recommend that you go see a nutritionist. So highly recommend seeing a professional. I really like the concept of when you're planning out your meals and you're trying to add more healthy things, adding in versus taking away. You don't really want to restrict any foods in particular, but say you want to add more vegetables to your diet, just swap. So maybe you were going to have some pita chips, so maybe add in some hummus with it, instead of like not eating the pita chips. Or you want some tortilla chips, add some guacamole. Add in some tomatoes to your guacamole. I don't know, like you can mash up an avocado and put some like tomatoes in there or something. So just like adding more to your plate versus taking things away. The more colorful your plate is, the better too. So that's another thing to think about. Okay, and then we're going to talk about bathroom habits and routines now, guys. This is more doctor advice, but your bowels really like routine. So when people are having constipation or inconsistent bowel movements, I will put them onto a bowel routine. So most people go first thing in the morning when they wake up. So what you would want to do is drink a warm beverage, because that can kind of let things start moving in the gut. So it could be like hot water, tea, coffee, whatever. Eat breakfast. 30 to 45 minutes after you eat, there is a reflex that kicks in to your body. And that reflex tells your body it's time to have a bowel movement. So in the meantime, after you eat your breakfast and drink your hot beverage, do some light housework, go for a walk, stay active, because the more you move, the more regular you will be. So it'll kind of get things moving. And then after that 30 to 45 minutes, try to sit down on the toilet and see if anything comes out. Do some breathing, undistracted, don't be on your phone. See if you're able to breathe and have a bowel movement. Prop your feet up, that sort of thing. If you don't sit for more than 10 minutes, it's fine. Just go about your day. But the more you kind of train your body to go at like a similar time of day, the more regular you'll be. And I've noticed that my time of day is like 3 or 4 o'clock, which it fluctuates because when I'm at work on my late days, that's really hard because I'm like between patients trying to go. But when I get off at like 2 or 3, then it's like immediately right after work, I'm like ready to go. So if you need to like shift your bowel habits, you could try out a bowel routine and see if that works. But yeah, I don't know if you've ever noticed, like when you're traveling as well, your bowel routine is all out of whack when you get back. You might not go for a while, or if you travel, you might be constipated and not go, because a lot of people find that it's hard to have a bowel movement when they're not in their own home. So I think there's a lot of nervous system involvement in that. So it's interesting, but it's really nice to know that you can kind of put yourself onto a routine and regulate your bowel movements if you would like to do that. We've talked about positioning, we've talked about timing and nervous system regulation, so breathing, relaxation, things like that. You can also, if you're constipated, do like a colon massage. So I always tell people, where is my left hip bone? So you're going to do like an I love you massage. So down is an I, up and across is an L, and then U all the way around. So it's called an I love you massage. But you're just going into the shape of the colon, and you don't have to like press hard or anything. You're not trying to push things out. It's just to help move things along and regulate the nervous system to let you have bowel movement, if that makes sense. So don't feel like you have to push super hard. If that's hard to remember, just remember clockwise. Yeah, that's clockwise. Clockwise circles. That can help if you're trying to have a bowel movement. Being constipated is very uncomfortable. I've been becoming more on the constipated side as I've been working to kind of regulate my bowels and things like that. So, yeah, it's not comfortable. But the other way around is not fun either. So I feel for you. I have worked with many patients who are very chronically constipated, and if that is you, I highly recommend that you go see a pelvic floor PT and work with a nutritionist. I remember one of my patients told me she didn't have a bowel movement for over a month, and that is very hard to imagine. So I feel for these people so much. So anyway, things like endometriosis, PCOS, trying to think of anything else. But there's a lot of underlying health conditions that can impact your bowel movements. So when you need to see professional help, if you're noticing that you're outside of any of these norms, I'd honestly recommend that you go see a pelvic floor PT or talk to your doctor or see a nutritionist. GI, urology, I get referrals from the doctors a lot. A lot of times if you go to your urologist or your GI doctor, they send you to pelvic floor PT. Pelvic floor PT is definitely becoming more of the norm, especially like with pregnant and postpartum. And pregnancy, postpartum, menopause, all of these things can onset bladder bowel issues. So really important stuff, guys. All right, and then just finally want to touch on some lifestyle things, some sister advice. Stress management is huge when it comes to bowel and bladder. So I know we keep talking about it in every single episode, but really going back to the rest and going back to the movement and going back to cyclical natures. Prioritizing stress management is huge because it affects your bowel and your bladder and your food intake and everything. Sleep impacts all of this. Traveling impacts all of this. Your body likes the rhythm, your digestion, your gut motility, things like that. So giving yourself grace when you're traveling, when you're stressed, taking extra care of yourself to make sure that you can stay as regular as you want to be. Exercise really helps with gut motility. So another reason why we love movement. Object in motion stays in motion. And if we are moving the gut, and it is allowing us to have better poops and yeah, just lets everything flow naturally. Okay, guys. So actionable steps for this week. I want you to prioritize hydration, prioritize fiber-rich, colorful plates, and I want you to just observe bowel bladder habits, and if you notice anything that is out of the norm that we've talked about today, consider reaching out to me, consider reaching out to a specialist, and just know that you don't have to struggle with these issues alone. So many women come to me and they find answers and find solutions, and I make their life a little bit easier, and it's not even anything that I do, it's really just educating people on what their body should be doing. So yeah, I think that is the end of this episode. Please reach out if you have any questions about ins or outs. I love this topic, and please comment below if there are any topics in this realm that you'd like me to dive deeper into, and I will be doing another Q&A episode at the end of the recipe to your wellness. So we did the first 3, reclaiming rest, emphasizing movement over exercise, connecting with your cycle, ins and outs. And for the last We'll be going through those in the next 2 weeks. And then we will have another Q&A episode. So if you have any questions related to ins or outs, please jot them down, reach out, send me a voice memo, and we can address it. Comment below if there's anything else that you want me to go over. Today, I just want to leave you with hydration check. So cheers. Grab your water. Cheers. Cheers me. You better cheers me. I'll be mad if you don't. Cheers to learning about the ins and outs of your body, and send this to a friend, send this to your mom, send it to your sister, send it to your boyfriend, send it to whoever, and drink up. Oh, I splashed myself. Cheers, and I'll see you next time.